Let's talk about something called an occult femoral hernia on ultrasound. Let's define what an occult femoral hernia is. This is just an opening or a defect that develops on the anterior abdominal wall at the femoral region. An opening where sometimes you find intestines or mental fat protruding through the opening. So what happens is the patient will come to your facility complaining of pain and swelling at the femoral region, and sometimes these hernias can be very difficult to diagnose. So once an ultrasound is requested, what we do, we use a linear array, high frequency linear transducer, just to examine the femoral region. And what do you see? You will see the hernia neck, you will see the defect. Sometimes you'll see the bile loops protruding into the defect, or you'll see amount of fat protruding through the defect at the femoral region. But most of the central sign that I've seen, when I'm doing this, is something in medicine we call a bubble, a speech bubble sign, or a speech box sign. Once you see this when you're doing an ultrasound and they're querying a hernia, so most of the time you will be dealing with an occult femoral hernia. So guys, when you're doing ultrasound, let us be careful. Let us be careful to look for some of these things. I know you're going to save the patient a lot of money for the patient having to go to other imaging examinations like CT just to diagnose this hernia. So those guys doing ultrasound, let us be very keen. When you pick some of these things, you can communicate it so that at least the patient can be assisted, the hernia can be corrected, so that at least the patient can go back to a normal life. Again, when you're doing hernia, remember just to look at the bile loops, make sure that there is no intestinal obstruction of the abdomen, make sure it's not strangulated, make sure it's not obstructed, and make sure you can see the blood flow on the wall of the intestine that are herniating, so that at least you communicate to the clinician. Every time when you're doing this thing, let us put in mind that we are doing imaging, but at the end of the day, let us put the patient at the back of our mind, at the center of our focus. Even as we report, we need to ask ourselves, is this report going to help the doctor who is looking at the patient? Is it going to assist the patient in a prompt way? So thank you always for following my videos and sharing. Let us keep on engaging. Let us keep on just learning, even as we assist our brothers and sisters out there. Thank you, and have a great day ahead.